is Gigi, and I'm going to be your nurse today.
Okay, hi.
Nice to meet you.
Nice to meet you too.
I'll be right back. I'm going to wash my hands. Alrighty, let's get our assessment started. Can you tell me your name and age, please?
My name is Chelsea Teixeira, age 22.
Awesome. And when is your birthday?
07/29/91.
Awesome. And I can see that the patient is a lower and oriented ×3 because she's answering all my questions. I can see throughout her body that her skin color is even, and there are no lesions noticeable, and I'll be assessing her skin throughout the entire assessment as well. Her facial expression is smiling. She's relaxed and happy and content. And her mood and affect is appropriate as well. Let's see. Her speech is fluid and articulate. Her hearing is intact and grossly intact because she's able to answer all my questions and respond. Let's see. She appears clean and well groomed. And at this point, I would measure her vital signs, but to save time, we're going to go ahead and pretend that we did. All right. I will now assess your hands and nails, if I can see your hands. Her hands appear clean, her nails are clean. She has really good cap refill on both hands. And the color and pigmentation is even on her hands. Her skin is warm and dry, and she has good skin turgor. I will continue to, and like I said before, I'll continue to evaluate her skin as I go throughout the assessment. So if you could look straight ahead for me, I can see that her nose is aligned, her eyes, her face is symmetrical with the rest of her body. And I'm going to assess your hair if you don't mind me touching it. Her hair seems healthy, there are no visible lesions in her scalp, no bumps or lumps anywhere. Her hair is nice and healthy. I'm going to be checking your temporal mandibular joint, so if you can open and close your mouth. There is no, I can't feel any clicking. Is there any pain when you do that?
No.
Can you move it to side? Oh, your jaw.
Oh.
There you go. Any pain there?
No.
Alright, awesome. I'm going to check your sinuses, so let me know if you feel any pain. Her maxillary and her frontal sinuses, do you feel any pain?
No.
Any pain here?
Mm-mm.
Good. Okay. I'm going to be checking your trace, your mastoid, and your pinna. So let me know if you feel any pain here in your pinna and your tragus. Any pain? Awesome. Okay. And now I'm going to test your facial nerve. So if you could please close your eyes and let me know when you feel something on your face.
Feel it. Feel it. Feel it. Feel it.
Okay. And it tickles, I guess. And that was testing the cranial nerve 7, and it's grossly intact because she was able to feel the cotton ball in all the right places. Okay, so now I'm going to be testing your eyes. Okay, you could hold this out at arm's length and close and cover one of your, yeah, that's fine. If you could read the second line.
874.
If you could read the fourth.
638 EWEXOO.
Awesome. If you could switch now. If you could read the first one.
95.
If you could read the third one.
2843.
If you could read the fifth one.
8745 EMW OXO.
Alrighty. Thank you. Very good. Put this away. Alright. What is my... Oh, there it is. Alrighty. I I'm gonna be checking your it's the confrontation test. So just let me know. Just follow the pen if you could. The 6 cardinal movements of the eye. She did great. You can look straight ahead for me. And her eyes, there's Perla. I don't see any visible swelling or any kind of lesions anywhere. Her cornea, anywhere. Let's see. Her eyelids meet when closed, and her eyebrows move symmetrically. Her eyeballs are aligned and they don't appear sunken or protruding. Her conjunctiva is pink. Very pink. Yeah, and her sclera is white. Now I'm going to use I can also see the light reflecting. I can see the light also reflecting equally from her cornea. You don't mind taking off your glasses for me? Thank you. Alright, I can see inside and I can see, sorry I'm so close. I can see her macula and I can see the two, I can see her optic nerve. Let me check the other one too. There are no visible lesions, no bleeding. Everything looks pretty good. Sorry for blinding you. Her iris appears flat and even in color. Her red reflex is visible and unstructured. Her optics was clear. Like I said before, the visible orange is present. And the yellow physiological cup and the 2 vessels we're seeing going into all 4 quadrants of the eye. And the retinal background is reddish orange, like I said, with no lesions or anything abnormal. Alright, I'm gonna test your ears. Check out your ears. Okay, and first of all, I can see that her ears are symmetrical with no tophi. And I'm gonna check inside. And I'm gonna hold. Okay, oops, I just turned it off. Upside down. And I'm going to support the base of her head, and I'm going to pull down. There we go. Okay. I can see her eardrum. It's not red, inflamed, doesn't look infected, and her eardrum is intact. And I would do the same with the other ear. Alright, now I'm going to check your hearing. So I'm going to whisper some words to you if you can repeat them back if you hear them.
Okay. Dog. Fish. Cat. Taco.
Awesome. Sounds perfect. Alrighty. And inside also I was able to see the cone of light in all 4 quadrants in the anterior inferior quadrants of the ear. Now I'm going to check her nose. And I can see also that her nose is midline with the rest of the body. Like I said before, there are no deformity, no lesions. I'm also going to see inside. You can lift up your head like this for me so I can see inside. Everything looks good. There are no lesions, no swelling. Looks good. If you could close one nostril and breathe in and out, and close the other one and breathe in and out. She's able to breathe normally and there's no obstruction in her nasal passageways. Okay, and then I was also able to see in her nasal mucosa that it was pink and moist, so she's well hydrated. Okay, and also her septum was intact and her tubernates were visible with no signs of inflammation. Okay, I'm going to check your mouth. You can open wide for me. Alright, her uvula goes up and she does have a gag reflex. Can you go ah? Can you stick out your tongue for me? Make it go up and down and side to side. Awesome. And can you just smile? Check your teeth. Looks very good. Her oral mucosa was pink and moist. Her lips are not cracked or dried. Her teeth look very clean, straight, evenly spaced. There's no decay. And the gums are pink with no redness or swelling. Her palate, let me see, her palate looks good. Her palate is intact with, there is rugae. Let's see. And the soft palate is pink, is moist as well. And her tonsils, you can open that wide again, are 0 on a 4-point scale. Okay. Alrighty. Now I'm going to check your neck, if you don't mind. And I can see that her neck is completely symmetrical with the rest of her body. There are no visible lumps or pulsations anywhere. And I'm going to palpate your lymph nodes, okay? Okay. Let me know if they're tender or painful. Right now I'm checking her submental. Right now next her submandibular. And her periocular. Her posterior ocular, behind the ear. Her occipital, behind of the head. Her jugular gastric. Her superficial cervical. Her deep cervical chain. And her posterior cervical. And then her supraclavicular. See if I can feel those. Sometimes they're kind of hard to feel. There's one. And then they are mobile. They don't appear swollen. And are they painful at all? And they are non-painful. Okay. I'm going to check your pulse. First starting on one side, never on both sides, because you don't want to kill the patient. Okay, that side is good. That side is good too. I'm going to hear your carotid as well. You would technically hear with the bell, but mine is a special kind of stethoscope, and you just squeeze and it turns into the bell. It's very strange. If you could hold your breath. 1, 2, 3. Good. Okay, you can breathe normally. And at this time, since some are in the neck, I'll also hear her thyroid. You can breathe normally. Okay. Alright. Oh, and I failed to mention that she has +3 on palpation, and there were no audible bruits or thrills heard. I can see also that her trachea is midline. There's no deviation of the trachea. Can you turn your head like you're saying no for me? Can you turn your head like you're saying yes? Can you turn your head against resistance with my hand? The other way. Very good. All right. And now we're going to stop to switch positions. Okay, right now I'm going to be assessing your lungs, posteriorly and laterally. So I can see that her thoracic cage is symmetrical with the rest of her body. There's no deformities. Can you lower your neck for me? Thank you. Her spinous process is midline. Does it hurt if I touch it?
No.
It's non-tender. Her rib cage expands symmetrically with inhalation. Do you mind taking a nice deep breath? Very nice. All right. And she has no visible lumps or tenderness anywhere that she has told me. I'm going to listen to your lungs now. Oops. Okay, if you could take a deep breath. Good. one more. All right. Her lung sound clear bilaterally. No adventitious sounds anywhere. And now I'm going to do textile firmitus. If you could please say 99.
99.
Very good.
99.
One more time.
99.
Very good. I'm going to do it on the front too. You can say 99.
99. 99. 99.
Very good. Okay. So now you're going to feel some tapping on your back. Okay? I feel resonance all throughout her lung fields. Yep. Right, now I'm going to be measuring diaphragmatic excursion. There it is. Alrighty. So I'm going to have you do exhale and hold. Okay, and then I'm gonna be tapping, and then I'll let you know when you can breathe again. And then the second time, you're gonna take a deep breath and hold it. So you're gonna do the opposite. Okay?
Okay.
Do you mind if I lift up your shirt a little bit?
No.
Okay.
Ready?
Yes. Go and hold. Alright, I could see here that her diaphragmatic excursion is around 4 centimeters, which is completely normal. Okay, so now you're going to feel a firm tap over your kidneys. Let me know if you have any pain, okay?
Okay. No pain.
Okay.
No
Okay.
pain.
Good. That means that her kidneys are doing pretty good. Alrighty, so now I'm going to be checking your anterior. And I can see that she's breathing symmetrically, no labored breathing, no grunting, no pursed lip breathing. It's completely normal. Alright, I'm also going to be listening to her heart sounds while I'm here. Her S1 and S2. Excuse me. Heart sounds are normal. There are no extra heart sounds, no murmurs heard. So she's doing pretty good. And before we change to supine position, I also wanted to say if you could go against my hand, and then against the other one, and then up and down, and side to side. I can see that the patient has full range of motion and no problems with her neck. Okay, now I'm going to be checking your chest, and I can see from here that there are no pulsations, and there are no heaves visible upon inspection, or I can't feel anything either. I'm going to feel your apical pulse. Lightly palpable. I'm going to be testing with 3 fingers. Still lightly palpable, and now with 1. And still lightly palpable. Okay, now I'm going to be checking your abdomen if you don't mind. Is it okay if I pull up your shirt? Okay. Upon inspection, I can see that she has normal contour to her abdomen. Her skin appears free of lesions, no abnormalities with her skin. Her skin is even in tone, and in color is appropriate with the rest of her body. I'm going to take a stethoscope in here in all 4 quadrants. There are active bowel sounds in all 4 quadrants. And now I'm also going to hear your arteries. Your aortic, renal, iliac, and femoral. Aortic comes up here first. Next is femoral on both sides. Next is your iliac on both sides. And last, your femoral. Okay, and there are no audible bruits, present. All right. So now I'm going to palpate in all four quadrants, light and deep. Let me know if there's any pain or discomfort.
No. No. No.
Okay, I felt no abnormal lumps or bumps. I'm going to feel some tapping. Let me know if it's pain here as well. There's tympani heard. Thank you. Okay, and next, I'm going to assess your liver and spleen. Your kidneys are non-palpable. So her liver is on her right side and her spleen is on her left. You can take a nice deep breath for me. Okay. You can feel the outer edges of her liver. There is no swelling noted, no lumps, abnormal bumps or lumps. It's pretty smooth. And her spleen is on her left side between the 10th and 12th intercostal space. And it's almost can't feel anything, which is good. Her spleen isn't swollen. It's pretty good. Is there any pain when I touch it here?
No.
Very nice. Alrighty, next I'm gonna check your abdominal reflexes. Okay, it goes one quadrant, second quadrant, third quadrant, and fourth quadrant. And the patient exhibits +3 reflexes in her abdomen. And next I will check your inguinal nodes and femoral nodes, and this is pretty uncomfortable, but they're within the right here, femoral and inguinal, and on this side as well. They're pretty palpable. They are mobile. Does it hurt when I touch here?
No.
Right, and they are non-tender, pain-free, and there's no swelling noted. Alrighty, now we're going to be switching positions. Okay, now we're going to be testing your upper extremities. Can you lift your hands up for me? Can you put them down and then back? If you can. And then put them like this on, like that.
Back.
Yeah. Alright, and then can you perform the Fallon test for me? Is that painful?
No.
Alright, so she does not exhibit pain with the Fallon test, which would, if she did have pain, it would and it be indicative of carpal tunnel syndrome. You can see that she has full range of motion in both her upper extremity. Can you shrug your shoulders? You go down again. Okay, sound good. Okay, now can you shrug your shoulders again with resistance? Very good. All right. And now I'm going to be checking your central, lateral, your epitrochlear, and brachial nodes. If you don't mind me, central. Sorry, I'm going to take a little bit. Central, lateral, epitrochlear, and your brachial nodes. And they're kind of hard to find. Okay, thank you. Alrighty. And now I'm going to test your neurological. Okay. Let me know when you feel something. If you could close your eyes. Okay.
Feel something. Feel something. Feel something. Feel something. Feel something. Feel something. Feel something.
Okay. And that's indicative that her cranial 7 nerve is intact. Okay. Can you put your hands out for me and touch your nose one side at a time. Awesome. And now touch my finger and then touch your nose. All right, and then the other side. Very good. All right, I need you to close your eyes. And I'm going to put something in your hand and you got to tell me what it is, okay?
The key.
Okay, very good. And that was a positive stereognosis test. Okay, and now I'm going to have you, if you could please, sit on the stool. Okay, I'm going to test your reflexes. Okay. Alright, so first, I'm going to be testing your patellar. Right here. Good. Very good. Next is going to be your Achilles. Very good. Your other side, Achilles. And I'll be also checking her Babinski. It's going to take a little bit. And she is negative for Babinski. I'm going to test your bicep and tricep. If you could just let your arm loose for me. There we go, just nice and loose for me, okay? Think of a warm, sunny place and close your eye. 1, 2, 3, very good. And on your other side, warm, sunny place. Very good. I'm going to check your bicep. Okay, just your finger nice and loose. There you go, very good. And nice and loose. You can put your nice and loose. Very good. Okay. And next we're going to be testing the musculoskeletal. You can stand up for me. All right. I'm going to have you walk across the room. Just back and forth. Very good. I can see that her gait is symmetrical. She has no problems walking. If you could put your heel to shin and rub down.
Heel to
Going on the other side. Very good. If you can stand on your heels. Very good. And then walk on your tippy toes. Very good. All right. And I'm going to have you turn around. This way, camera. And if you could twist side to side. Very good. If you can bend forward. And then stay there.
Oh, stay there.
I'm going to check your spinous process again. Very good. Not painful, right?
Nope.
Okay, you can come back up. And you could see there that her hips have full range of motion. Okay. And if you could do a squat for me. Very good. I can see here also that her legs are symmetrical. There are no signs of atrophy. They're even colored. She's warm. And my patient shaves her legs, so there's no hair currently. But let's see. You can take a seat. I'm going to check your pulses. Okay. First, I'm checking your pedal pulses. They're strong. Check your dorsalis pulses. They're strong too. And I would check her popliteal. They're kind of hard to feel, but since I assessed her two other pulses on her extremities, I could see that she is having blood perfusion down to her extremities very well. Okay, let me see if I'm missing anything else. And all her cranial nerves are intact. 3, 4, and 6 I tested with her eyes, and hearing cranial nerve 8 is intact as well. Well, we would also have a genital assessment at this time, but we're going to omit that due to privacy reasons. Do you have any questions for me?
No.
All right, well, thank you very
All right,
much.
thank you.
Take care, and if you have any questions, don't hesitate to ask.
All right, thank you.